Welcome back to the Kahai Afternoon News. Good afternoon. I am Casey Freelove. Well, we're all getting very excited. I, of course, am the sports director here at Kahai, and we are looking forward to the return of Oakland A's baseball and Sacramento Kings basketball right here on 104.5 FM and AM 950 next week. Other sports have been able to successfully get underway, including NASCAR, the UFC, and the Professional Golf Association. Want to talk a little bit about keeping athletes healthy and also just about kind of the restart of sports and how different groups are helping. Joining us to discuss is Lauren Pasquale with Fastaff Travel Nursing. Now, this group was on the ground at 8 professional sporting events across the country during the month of June, helping with on-site health care, including temperature checks. They're part of a team gathered by S2 Global, which is a logistics leader in security and safety for large-scale events. Let's welcome her in. Lauren, thanks for being with us. How are you this evening?
Hi, Casey. I'm great. Thanks for having me.
I really appreciate you coming on. I mean, I feel like a man on a desert island, Lauren. I live my life by watching sports every day. Obviously, I'm very passionate about it. A lot of people have just kind of felt like there's that missing ingredient. Obviously, these are the strangest times that anybody's ever been alive. Very concerned about the health and safety of society. But sports is a big part of society, and finding a way to get them back out there, I think, will be one of the key points as far as a return to the new normal. So let's just start with that.
I agree with you. I'm feeling it too. Definitely missing sports, and we just want to be a part of helping sports reopen safely. We're ready to get back to that.
So I want to talk a little bit about your group, Fastaff Travel Nursing. You've been around for almost 3 decades, and obviously in the spotlight now because there are such limited spaces available for whether it's media, personnel, or staff at these various large-scale events that typically would have, anywhere between 5, 10, 15, 20,000 and above. So talk to me a little bit about what your group is doing, and we'll go from there.
Sure. Well, Fastaff Travel Nursing is a rapid response, high acuity healthcare staffing company. So we're based in Denver, and our typical assignment is sending high acuity nurses into urgent and crucial situations. So we're normally sending nurses into hurricanes, floods, fires. We sent nurses to take care of patients during Ebola and now the coronavirus. So going back to February, we've had thousands of nurses deployed all over the country. They go in for these short-term travel assignments. They go where the need is most, Casey. So for the most part, from Seattle to Northern California to New York City, they've been chasing the hot spots. And around Memorial Day, this was a little bit unusual for us, but the company that you mentioned, S2 Global, reached out to us around Memorial Day and said, we're opening up these golf tournaments, PGA and Korn Ferry Challenges in a week, and they decided they wanted to have more healthcare professionals on the ground to screen the participants. So they reached out to us, and because we can deploy nurses very quickly who have this experience, we started sending the nurses to lovely golf courses all over America. I think they all thought they died and gone to heaven, but that's where they are right now.
Well, especially with a lack of fans in the stands, they kind of had a front row view to something that, I mean, let's be honest, it looks a little odd on TV to not see people scattered around the course, but it's so imperative to make sure that the players are healthy. Now, golf, in my opinion, has the advantage of being kind of an individual sport. Yes, we can factor in the caddy, but as far as not having to worry about kind of the blood and sweat that is associated with football or even, basketball with guys flopping all over the place. But what was the experience like for them? I mean, what kind of staffing numbers did you have there? And let's just kind of walk through maybe, the process from when you get on the ground heading towards the Thursday when they get the tournaments underway.
Mm-hmm. Well, the tournaments actually start pretty early with those practice rounds. So typically on a Monday or a Tuesday, the personnel start coming in, the players and the caddies. I was on the ground at TPC Sawgrass during the first week of June. That's in beautiful Ponte Vedra, Florida. And so TPC Sawgrass had 3 different entry points. And what happened with our nurses, we had 4 nurses there who would rotate between these 3 entry points. As the people started entering in their cars, the golfers, the caddies, the grounds crew, service personnel, before the car even parked in the parking lot, they would stop at a tent manned by S2 Global and our nurses, and they were given a temperature check. And if anybody in that car registered a temperature of 100.4 or higher, the car was pulled over, the person was asked to sit in the tent for a few minutes. And this is where our nurses' experience really came into play, because some of them had just come off COVID assignments, and they're able to look at the person, kind of take an assessment of how they're doing and what their symptoms might look like, and then they would give an inner ear temperature check, which is more accurate. So before before anybody could even go park their car and start walking into the clubhouse or facility, this was the first line of defense.
I'm happy to hear that you did allow folks, though, if they were running a little hot, to go into a cooling tent, because anybody that's been in the sweltering Florida heat understands that, your body might just kind of overheat anyway if you're not getting proper hydration, right?
Yeah, or if you've been blasting the AC in the car, your temperature might be out of whack. So, yeah, they needed to go sit aside for a few minutes and get back to normal.
Now, if somebody was, remaining above that threshold that you mentioned there, I think you said 100.4 degrees, what's the process there? I mean, you're not there to treat people with COVID, but you are there to kind of, fire those early indicators saying, look, you might want to check in with a doctor about this.
Correct. So if it was one of the grounds crew, one of the service personnel, media, anybody working the event, they were asked to leave and encouraged to go seek medical treatment, to find out what was going on. But if it was a player or caddy, they then go visit with the PGA doctor and they take it from there.
Were the players receptive? I think what you did was probably the least intrusive way of doing it. You're saying, look, we're not even making you get out of your car and walk over here. We're going to basically test you right here. What was the reception like? Because let's not kid ourselves. The reason why this is such a scary disease is those may be healthy professional golfers who probably aren't at risk of severe symptoms. I mean, possibly. But everybody's got a family. Everybody's got elderly family members. A lot of us have family members with immunocompromised systems. So we all have to be wary, even if we're not as concerned about our own health.
I would say the players and everybody who came through were as lovely as could be, Casey. They were patient. They were friendly. Our nurses approached the car wearing masks and gloves. And for the most part, everybody, would flow through pretty quickly. It doesn't take too long to do this process. So I showed up for a few of the 4 a.m. agronomy call times, and you might get 15, 20 cars in an hour. But for the most part, it doesn't slow them down, and they keep moving. I just read a quote from Tiger Woods, who's back at the Memorial this week, and he said, you know what, it's a risk I'm willing to take. I want to be here. And I think the players know that they got to jump through a few hoops to do what it is that they love doing.
Now, with the S2 global platform, are you using kind of, we're all getting familiar with these new terms. They're kind of non-invasive. It's basically you just rub a thermometer, or not rub, but you place the thermometer near the forehead, and that's how you do the readings?
Exactly. They could hold that thermometer a couple inches from the forehead, maybe an inch and a half from the forehead, so they don't even have to make contact with the people in the cars. It's just if you do the inner ear thermometer that you're actually going to make contact.
Now, as far as, and again, we're visiting with Lauren Pasquale. She's with Fastaff Travel Nursing, and they've been touring around with the PGA, helping keep the players safe. After the TPC, where did you move to next? And I guess, what are the plans moving forward? Because this pandemic's not going away anytime soon, and sports are going to have to be just extra vigilant, or they're going to be in danger of having their season shut down.
For sure, Casey. We had nurses. I myself didn't pop around to all the tournaments, but we had nurses at the Korn Ferry Challenges and the PGA tournaments that were in Hilton Head, Fort Worth, Texas, Utah, Berthoud, Colorado. So we actually ended up doing 12 different events around the country, Connecticut, Michigan, and we're just wrapping up this week. Now, we are ready to help any business, any sport, anybody who needs to run people through these temperature checks just to keep large gatherings safe. We're ready to go anywhere we need to go. So if the NBA were to call from their bubble, or the NFL or the MLB, as those guys get ready to travel next week, ready to go and ready to send nurses at a moment's notice.
What are your thoughts? We're here, a local station. We've got a high school here called Placer High School, one of the oldest high schools in the region. So we do play-by-play sports for them, whether it's football or basketball. We like to get the kids, kind of their moment in the sun. Just as somebody who works in this field, are you hopeful that we're going to have sports at some point and fans will be allowed in the stands? Or, just from like your perspective, having already been at these PGA events, what do you think about as we get down lower? Because to me, there's a big difference between a professional athlete like a golfer who is getting paid for his performance on the court versus some kids who might just be playing for the love of the sport and might not have a chance at going to the next level.
Yeah, so, I'm not a medical professional, but
right.
My personal opinion, I noticed I was a high school athlete, and I really was, very serious about it. I know that it's heartbreaking for kids to work so hard for so many years and not get on the field to play. So personally, I would want to see them on the field to play. However, now that we see these contagions spiking in, over 30 states around the country, it makes me more nervous about people gathering. So I guess not as a medical professional, I guess I would say we probably need to keep separating as long as possible until we have this vaccination in hand and, protecting people on a wide scale.
Lauren, let me ask you this about the S2 Global platform and doing this testing of the PGA athletes. Privacy is always a concern. I even get a little weary about reading on, because I do sports reports every day, and I don't want to Hester print anybody or brand them with a scarlet A because they unfortunately got COVID, as have millions of Americans at this point. But are there any privacy concerns if somebody did show a high temperature, or how do you handle those concerns?
Okay, so I'm not an expert on this, Casey, but I'm guessing from many years of working in sports, but I would imagine that the players' associations and the leagues have some sort of agreement about what could come out through the communications departments. I'm sure the players' associations really protect those players in the right way. Having said that, I know that the PGA has announced the name of some of the players who tested positive. Luckily, those guys were able to go home, stay put, stay in their house, rest for a while, and nobody's really getting sick from the virus, which is wonderful news. But I think that's how that process works.
And just as far as were you able to get out there and watch a little bit after? Because, once you've got everybody out there and you've tested, I assume you probably do this every day, but do you get a little bit of free time to kind of maybe walk around the golf course a little bit? Because you're certainly going to be able to see things that an average person wouldn't be able to, especially in these crazy times.
I did not walk around the golf course because I wanted to stay out of that clean environment, but I will tell you from where I was lodging, I had a beautiful perch, and I could watch the golfers go right through on the fourth hole and the sixth hole, and I enjoyed it. It's so beautiful. It's just such a great sport to watch, so I got to enjoy it a little bit.
Now, you mentioned that Fastaff travel nursing would be available if other sports leagues call. It seems like a good idea and kind of a great jumping-off point. Where can we get more information about the company and just a little bit about the work that you folks are doing right now?
Thank you for asking. We can, I would advise people, whether they're looking to hire nurses or very much nurses out there who are interested in these travel assignments, I would encourage them to go to our website, which is fastaff.com. It's Fastaff. Fastaff.com with those two words combined. Mostly we're looking for those special forces of nurses who are willing to travel at a moment's notice and go into some, interesting and sometimes dangerous situations. But for any sport that wants to increase the number of medical professionals in their environment, we're really wonderful at sending nurses very quickly within 5 days or less, and we could be available, like I said, at a moment's notice.
It seems like a good opportunity as well, because one of the weird or weirdly unfortunate offshoots of this whole pandemic has been some of the hospitals in because California is such a diverse state. You've got very rural counties and very urban centers, but unfortunately some nurses have been either furloughed or laid off a little bit because there wasn't enough activity in the hospital because people have been staying away. So maybe if somebody's out there listening and kind of unsure, that this might be a good place to start looking.
Yes, and one of the things about people staying away, I've talked to many of our nurses and healthcare providers who say people should not be staying away from the hospital if they require medical attention. As we both know, those elective surgeries really dropped off, and operating room surgeries dropped off for a while there. But there are people who need to go to the hospitals. The hospitals have such safe environments at this point, and in most cases, they're separating the COVID patients from the others. And even though you don't know for sure, people should not put off healthcare if they feel they need it.
I would agree, and I've got a friend who's dealing with a loved one who has cancer and is getting treatment for it. And from what I've heard, nothing but absolute safety, different entrances. They've definitely kept people that are dealing with different types of ailments away from people that are specifically focused on COVID. So I'm glad you mentioned that point. Don't put stuff off, folks. Cancer screenings, essential things that need to get done. Make sure that you're still getting out there. Now, if you want to get more information about this group, Fastaff Travel Nursing, as Lauren mentioned, you can go to fastaff.com, and that's Fastaff. So just cut off the second S. Fastaff.com. Lauren, very great what you folks are doing. I wish you continued success, and if any other sports leagues come calling, we know you'll be there. Thanks for spending a few minutes with us here today on Kahai.
Thanks so much, Casey. Have a great night.
You do the same. We'll take a quick break and be right back. You're listening to the Voice of the Foothills.